Hi, this is Dr. Paul Davis. I've been asked to answer some questions regarding the insurance industry and how it relates to the medical field. We initially had a moderator, but that was being done by long distance, so I'll try to do this solo. I think the first question the moderator had is if I could think of two major pitfalls or problems with the insurance industry as I see as a practicing physician. There are several, but let me point to the two most glaring problems that I see in private practice. First is the problem with patients who need to have pre-approvals for procedures or diagnostic tests. With that, I mean patients will purchase insurance premiums through their employer most of the time, and to at least moderate the amount of increase in insurance premiums, they'll be offered insurance plans that have increasing amounts of deductibles, or what we like to call in the industry high deductible plans. What happens with those is that the deductibles for the patient continuously increase every year, and now sometimes we'll see them in the $4, $5, $6, $7,000 range. What that means in practice is a patient thinks they're insured, they've purchased insurance, they'll come into an office such as mine and they'll need an exam or a procedure. So let's say they need a CT scan. Most people are aware of CAT scans, they're rather expensive tests. We'll say they need it, they agree with us on a plan of action, we'll order the test, and the patient will get a bill for the amount that the insurance has allowed. So let's say it might be $1,000 or $1,200. Well, they're under the impression that they had insurance. Yes, they had insurance, but they haven't met their deductible. And this can go on and on until they reach their out-of-pocket deductible, which in some cases is as high as $5,000 or $7,000. And that's outrageous for a lot of working people. It's a lot of money to ask them to pay, and they really just don't understand why, if they have insurance and their insurance agrees to have this test, that they are then in turn responsible for the amount. So that's one of the most difficult parts of our practice, is explaining to people and having our staff explain to people what that means in practice, and how they're just feel like they're constantly laying out money, not only for premiums, but also to meet these deductions that the insurance company has put in front of them that they need to meet prior to the insurance company paying some percentage of their health care. That's number one. Number two, which I alluded to a little bit in the first answer to the question I posed, is the problem with having patients get approvals for exams. So what this means is, even though I might think an exam is necessary and the patient understands this and wants to go ahead with a test, we then have to get approval from their insurance company. This is the case with almost all private insurances that are around today. What this means, if we think there's a test, and we'll use that CAT scan as an example, we then have to call some mid-level provider or somebody at the insurance company and ask their permission to perform this test, even though we think it's necessary and the patient agrees. They, and then at their discretion, may or may not approve it. They oftentimes put roadblocks in front. Have they tried other conservative therapies? Are there other tests that are less expensive? Have they tried other measures? It goes on and on. And what I see is that this is oftentimes a roadblock for us to try to get around and over, because a certain amount of the people and physicians will just get tired and almost give up. This is really detrimental to patient care, and as I see, is a huge roadblock in getting these approvals. Sometimes we'll kick it up the ladder and I'll get to talk to a medical doctor at one of these insurance companies, but you can imagine the hurdles that must be gone through first to get to that level, and all this takes time. All this takes my staff's time and my time, and takes time away from patient care. So those are the two biggest hurdles I see in private insurances facing the private practitioner. Lisa also asked me to touch upon what I thought was the most efficient healthcare system today. And while their payments are not ideal, I would say that straight Medicare is rather efficient. It's run fairly well by most organizations that run these for the government. They pay in a reasonable amount of time, although not well, they do pay. And so that's about the most efficient system I see out there. Now, a lot of seniors are going for Advantage programs. What these are programs that are sold to seniors because there may be advantages to them, like including well care, including some drugs, some therapies. But the problem with that is they're somewhat restrictive in that the patient gives away their rights to the insurance company in sense to say, well, we think that this is or is not necessary, almost like the problems that I explained with private health care. So now the seniors have these same hurdles that private insurers do. And while on the outset it seemed like a great deal for them because everything's off their plate and insurance companies going to take care of them, they are left with these hurdles and barriers and have difficulty in understanding why, if they have Medicare, they can't get certain tests or procedures performed, even though Medicare allows them. Again, they've essentially given away their rights to the insurance company. So that's, while Medicare is great, we're seeing an increased amount of seniors being sold this Advantage care program, which is difficult. So I hope that was helpful. Again, this is Dr. Paul Davis wishing you all well. Thank you.